Why does the prevalence of smoking seem to be higher in marginalized communities? It's an unsettling question that begs to be asked. Today, we delve into the heart of this issue through an intriguing tale of research and discovery. Tobacco, a silent killer, claims over 8 million lives every year across the globe. More than 7 million of these deaths are the direct result of tobacco use, and a shocking 1.2 million are due to secondhand smoke exposure. It's no surprise then that the specter of lung, liver, oral, and throat cancers, chronic obstructive pulmonary disease, heart disease, and stroke all loom large over the lives of smokers. In Pakistan, the tale takes a darker turn. More than 25 million tobacco users struggle under the weight of this addiction, with smoking being a prime culprit behind cardiovascular disease, lung cancer, emphysema, and chronic bronchitis. Despite numerous initiatives like increased prices and taxation, stern warning laws, and public smoking and advertising bans, the success rate of smoking cessation is less than 3%. A majority of smokers yearn to quit but find themselves shackled by their addiction. Recent research has unveiled a worrying trend of escalating cigarette consumption in marginalized areas. Socioeconomic factors such as poverty, lack of education, and limited access to healthcare have exacerbated this issue, making the inhabitants of these areas more susceptible to the detrimental effects of tobacco. The Alternative Research Initiative team conducted a revealing study on the barriers to cigarette smoking cessation in Pakistan, evidence from qualitative analysis. The results were startling. A lack of awareness about health risks associated with smoking contributed significantly to the rising trend of cigarette consumption. This ignorance has resulted in a higher prevalence of smoking-related diseases in these areas. To tackle this issue, comprehensive anti-smoking campaigns targeting marginalized communities are crucial. These campaigns must focus on raising awareness about the health risks of smoking, providing resources and support to help individuals quit, and enforcing stricter regulations on tobacco advertising and sales to thwart the tobacco industry's attempts to prey on vulnerable communities. The study also highlighted an alarming dichotomy. Marginalized communities where smoking cessation services are scarce have easy and cheap access to unregistered, illicit, and low-cost cigarette brands. This insight into the barriers to smoking cessation can help shape effective and accessible interventions. The study also shed light on the disturbing fact that smoking initiation often begins before the age of 18, due to factors such as the presence of older smokers at home, lack of parental guidance, poor enforcement of tobacco legislation, and ignorance about the legal age to start smoking. It also revealed that those with lower levels of education and in poverty or social deprivation are more likely to smoke and find it harder to quit. This tale of research and discovery paints a grim picture, but it also lights the way to a possible solution. It's time to rally behind anti-smoking campaigns and policies, especially those targeting marginalized communities. Support them, advocate for them, because it's not just about saving lives, it's about creating a better, healthier world for all.